The heart bypass surgery recovery period relies upon multiple factors. Still, the recovery period is good. After heart bypass surgery, the patient has to remain in the hospital for about 7 days so that medical staff can look into the recovery closely. The recovery time varies slightly from one patient to another. Usually, it takes 1 day to attain a state where you can sit in a chair, 3 days to be able to walk, and 5 to 6 days to be able to climb up and down stairs. In general case, a person recovers fully after about 12 weeks after surgery. However, the recovery can be delayed in case of any complication during the recovery or during the surgery. Even in a general case, in the absence of any complications, an individual takes a minimum of 6 weeks and a maximum of 12 weeks to recover after surgery. This time is actually required for the breastbone to heal. Bypass surgery recovery at home. You need to take painkillers for the recommended time to minimize the soreness in the region where cut was made. It is helpful to wear loose and comfortable clothes so that the wound does not rub against the tight clothes. It is normal to feel weakness for the duration of 3 to 6 weeks from the time of surgery, as most of the energy is utilized in the healing process. Only after about 6 weeks you would be able to perform daily activities comfortably. Full recovery requires 3 months. Activities after bypass surgery. Once you are discharged and returned to home, you have to wait for a few weeks, after which you can perform all the activities. In the meantime, you are restricted to light activities like cooking, walking, playing indoor games related to boards and cards, lifting light objects, etc. The time before you can return to work depends on the nature of your work and your process of recovery. Normally, it takes 6 to 8 weeks, but in case of complications or if your work involves hard physical activity like standing or lifting heavy objects, you would have to wait longer. The time after surgery can be stressful, and you have to be patient enough for a few weeks, after which the things will start to ease out and get better. Cardiac rehabilitation for bypass surgery. Cardiac rehabilitation is a type of exercise program run by the medical professional to develop strength in your body to be able to perform physical activities easily. It is especially helpful in recovery after bypass surgery. Taking proper diet rich in nutrients and regaining physical strength are the important aspects of recovery for the patients of coronary bypass surgery. It is observed that cardiac rehabilitation is not only helpful in recovery, but works like a lifesaver. People following cardiac rehab program have more chances of staying fit and alive after 5 years from heart treatment. Cardiac rehabilitation is also helpful in increasing the stamina to perform physical activities, making your life better, making you feel good from inside, bringing healthy changes in your lifestyle, and making you feel comfortable with medications. Helping loved ones recover after bypass surgery. Doctors would recommend certain post-surgery care instructions to be followed after getting discharged to the patient and caregiver. Driving after bypass surgery. It is not safe to start driving just after the surgery, even if you feel comfortable. Normally, you can start driving after 6 to 8 weeks. If the surgery is less invasive, you can start driving even earlier. However, you can always travel as a passenger. Diet after bypass surgery. Healthy diet is always helpful